All right, today we are diving into a really fascinating and maybe even a little radical idea about the future of medicine. We're going to explore a proposal for a brand new kind of doctor, the oncologic interventionalist, a role designed specifically for the age of AI. So let's just start with the big provocative question. As artificial intelligence gets better and better at the thinking part of being a doctor, what's actually left for the human to do? And look, this isn't some far-off hypothetical. It is already changing the game in really complex fields like cancer treatment. So first, let's look at how AI is already showing up in the doctor's office. Because this isn't science fiction anymore. It's a reality that's changing the day-to-day workload, especially in a field like oncology. More and more, the core thinking tasks, the real heavy lifting mentally, are being handed off to machines. We're talking about incredibly complex treatment planning, sifting through mountains of medical documentation, and even handling parts of patient communication. A lot of that cognitive load, it's increasingly being shouldered by AI. But, okay, as the machines take on more of the thinking, there's one critical area that remains, something they can't touch, and I mean that literally. This brings us to the procedures that absolutely still require human hands. The source material we're looking at today just puts it perfectly. It says, no matter how smart the algorithm gets, performing a physical procedure on a patient remains, for now at least, a deeply human act. It's all about skill and judgment that you just can't fully automate, yet. And listen, we are not talking about simple tasks here. These are incredibly high-stakes procedures. We're talking about things like meticulously placing brachytherapy needles to deliver radiation, administering these advanced radioligand therapies, guiding biopsies and ablations in real time, or delivering immunotherapy right into a tumor. All of that, it takes a steady, expert human hand. And this is exactly why, even with the most advanced robotics, a human expert is absolutely essential. Because you know what? Things go wrong. Complications pop up. Algorithms fall short. You need a person in that room to adapt, to intervene, to be that final, critical layer of human oversight. So all of this brings us to this central proposal from our source. If AI is going to handle the thinking and humans are going to handle the doing, then maybe we need a whole new kind of doctor, a new clinical identity designed specifically for this new reality. And here it is, the oncologic interventionalist. The whole idea is to create a physician whose main job, their specialty, is to lead and perform the hands-on, procedural side of cancer care, all while working inside a system where the big picture strategy is largely guided by AI. Okay, so how would you even create a doctor like this? Well, the proposal actually lays out a pretty clear two-step path. It would start with a 4-year integrated oncology residency that would combine radiation, systemic therapy, and AI oversight. And then that's followed by a brand new, super specialized 2-year fellowship that's all about oncology interventions. So what would that special fellowship actually look like? Well, the training would be laser-focused on hands-on procedures. About 30% of it would be on brachytherapy, another 50% would be split between radioligand therapy and other image-guided procedures. And this is really key, a full 20% would be dedicated to mastering the robotic systems that help make it all happen. So now we've got this new specialist. How in the world would they fit into the bigger picture of treatment without stepping on everyone's toes? Well, the key word here is collaboration. And this is absolutely crucial. This role is not meant to replace existing specialists like interventional radiologists or surgical oncologists. Not at all. It's meant to be a new kind of partner. This new doctor would have full oncologic responsibility for the patient, but they'd be focused specifically on carrying out these AI-guided procedures, really building on the kind of work radiation oncologists already do. And there's some really smart, forward-looking logic to this. As AI gets better and better at diagnostics, at reading scans, the need for human diagnostic radiologists could actually shrink. And if that happens, you might create a gap in the number of doctors trained for these complex interventions, especially in oncology. This new oncologic interventionalist specialty, it's proposed to fill that exact gap. So at the end of the day, it's really about creating a formalized, clear career path. It takes all the advanced procedural work that many radiation oncologists are already doing, and it just expands on it, giving physicians who are really passionate about the doing side of medicine a clear way to lead in this new AI-powered future. So what's the one big takeaway here? It's this proposal for one new clinical identity, a new kind of doctor designed from the ground up for a future where medicine is a true partnership between human hands and artificial minds. And that kind of leaves us with a final thought to chew on. As our machines get undeniably, incredibly smarter, what if the most valuable, the most critical, and the most human job in all of medicine isn't about having all the answers, but about having the final expert touch?